I'm Peres Odero Diambo. As a CHW, I do household registration, I do home visit, I refer the client and do follow-ups.
I am Deborah Marie Olombo, community health worker. My experience of using eCHIS has reduced my workload. It has made work easier. I can visit household follow-ups for pregnant mothers. I can do newborn visits. I can do a lot in a short time without carrying a lot of tools.
Initially, we used a lot of writings and carrying heavy books to the community. But nowadays, we only use the phone. It is easy to work with. It is very accurate compared to the writing.
What made Kisumu County move from manual system to the digital system is the cost of acquiring the reporting tools for the community health services. The data from the community health volunteer used to get lost. Either the data has been destroyed by rain or flood, being that we're in a floody area.
Data is the basic thing in healthcare delivery system. Data plays a critical role because it helps us to make very critical decisions in healthcare delivery system.
eCHIS in full is the electronic community health information system, and this is a term or phrase that was coined by the Ministry of Health, who are the leads in the digitization program of the community health workers in Kenya, to be able to come up with a system that is reliable, system that is relevant, not only to meet current needs, but also to meet future needs. We believe we have to start with the people and not the technology, so that the end user who's using the system, be it a community health worker, the community health assistant supervising that community health worker, the county and sub-county teams, the national teams who are consuming this data for decision-making, policy-making, and investment in community health, get that which they require to be able to move and progress the community health agenda forward.
We have already moved into the electronic community health information system in Kisumu since 2020. So the data moves from the community health volunteer to the CHA, that is their supervisor. At the end of the month, the data is collected and a trigger is sent to the community health assistant as a supervisor.
My name's Effie Auma Omuko. As a CHA, I supervise community health workers, ensure I summarize the end-month reports. I also do support supervision to monitor their performance.
Whenever community health workers visit a household, I as a supervisor, I should be in a position to see that actually the community health worker has registered a pregnant mother, has done a referral to an under 5 years for a service at the health facility. So it is easy to trace and locate and do follow-up for these cases, even when there's CHVs in place. Just through phone call, you can do your work with the apps.
eCHIS has made the work easier for the referrals being made by the CHW at the community. Before a client reaches the health facility, already the facility in charge or the nurse in charge already has the information on the note that there is a client coming and to be handled on this and this.
So the importance of community health workers is that they are the users of the system, and so they need to be equipped, they need to be trained on how to use the system, and that's what we are currently doing as we enter into the scale-up phase.
I normally say that community health workers are the kings and queens of healthcare delivery system. It therefore means without the community health workers, implementation of community health services may be a big challenge within the county and healthcare delivery system.
My colleagues in other counties who want to take up this is the best deal. In Kisumu, we are having credible data, and this credible data, we are able to make decisions, carve out interventions out of them. The support I would wish is to be recognized by the government as a health worker, because I'm the first contact in the community. I know my households, I know their challenges, I know what they are going through.
For us to be able to reap maximum benefit of community health strategy, we need to professionalize, equip, and pay our community health workers in Kenya.
Professionalize community health workers with payment, training, supervision, and eCHIS.
CHWs should be professionalized.
Good health for our communities, good health for our households, good health for our families, good health at community level.
Afya bora mashinani.
Afya bora mashinani.
Afya bora mashinani.
Afya bora mashinani.
Afya bora mashinani.